What determines whether a family is healthy? When asked this, most people think of doctor's visits, a healthy diet, and regular exercise. But health is more than just visiting a healthcare facility. There are many factors affecting families' health, such as where they live, the resources available to them, and the opportunities they have, which can influence their health and well being. These factors are known as the social determinants of health. Education can influence how families find, understand, and use health information. These skills can affect everything from taking medications correctly to recognizing changes in symptoms and knowing when to seek medical attention.
In regards of education, income, and access to health, one Canadian study found that only 50% of patients in the study had adequate health literacy. Patients with poor health literacy were 3 times more highly likely to return to the ER within 90 days of discharge. These effects can extend across generations for many families. Patients and caregivers are ones who are making the important decisions about medication, nutrition, physical activity, and preventative health care for their children.
A family's income can influence nearly every aspect of their health. Financial stability affects a family's ability to afford nutritious food, safe housing, transportation, medications, and other resources that support their family's overall health. Research in Canada has found that families experiencing lower and less stable incomes are more likely to report poorer health outcomes and higher chances of long-term problems. The effects go beyond physical health and affect parental coping, relationships between partners, parenting practices, and overall child's well-being.
Although Canada has a publicly funded healthcare system, this does not mean that every family has equal access to healthcare. For many rural families, receiving specialized care requires traveling long distances away from home. A study of rural patients in British Columbia found average transportation costs of $856 and accommodation costs of $674 when traveling to receive healthcare. These costs does not include all the additional challenges families may experience, including lost wages, childcare needs, and increased stress. For some families, these barriers can result in delayed care or prevent them from seeking care altogether.
Education, income, and access to healthcare are all connected and affect families' overall well being. Difficulty understanding health information can make navigating healthcare challenging, while financial instability can make transportation and other healthcare costs unaffordable for any families, along with limited access to healthcare aids in less prevention of treatable conditions. Together, these social determinants can create barriers that affect parents, children, and the health of the entire family.
Improving family health requires us to look beyond individual choices and consider the conditions in which families live, learn, work, and access healthcare. By recognizing and addressing the social determinants of health, we can work toward healthier families and communities.